All right, part 4 of the Crohn's and colitis solution. We're getting into our first supplement now, and this one is a big one. It's a heavy hitter. I'm going to show you why, but pay attention. I'm gonna summarize as much as I can, but this is going to be super important info for you if you have Crohn's or ulcerative colitis. I'm super excited to share this one with you. For those that I've known personally that have tried this for Crohn's and ulcerative colitis, this one's made a big difference. Now it's definite. We're still in the beginning of the course here. This is the just getting into it, but we are going to pick off the lowest hanging fruit first. So we're going to be picking off the powerful ones first before we get into some more detailed strategies. So this is a big one. I hope you're excited. So here we go. Niacin. Niacin is the first supplement. And if you know anything about niacin, you might be thinking right now, why would niacin help Crohn's or ulcerative colitis? Well, I'm going to show you exactly why. This information, I hardly know anyone that knows about this, even though people that have been researching Crohn's and ulcerative colitis for a long time fail to see the connection between niacin and their disease or their condition. So I want to get into exactly why this can help you. So niacin is kind of the quintessential anti-inflammatory heart vitamin. Niacin is vitamin B3, and it's been used for a long time for heart disease. It was used a long time, long before statins were ever used for high cholesterol. Niacin was the one that doctors were using. So it's been used for decades and decades, for over 70 years now. Now, niacin's most known for its effect on high cholesterol levels. When people think about why you would supplement niacin, most of the time it's to reduce high cholesterol levels. But that's not really exactly how niacin works. You see, most doctors only think that niacin improves cardiovascular health through influencing cholesterol levels, like decreasing LDL, increasing HDL, decreasing triglycerides, all of that stuff, basically improving your whole cholesterol profile. And while it does do that, it doesn't do that the same way that statins do. So statins block the production of cholesterol. Niacin doesn't block the production of cholesterol. The way that it influences your cholesterol profile is through its effect on inflammation. So because niacin has such a profound effect on the inflammation of the blood vessels, that's actually how it benefits your heart health. That's how it reduces cardiovascular risk like heart attack and stroke. And most people don't fully understand the cause of heart disease, but heart disease is essentially caused from chronic inflammation that fails to resolve like it should. Does that sound familiar? Because that's exactly what's going on in your intestines with Crohn's or ulcerative colitis. Now, most people think that it's high cholesterol in and of itself that causes heart disease. There's a lot of doctors that are still, saying things like this. But we've known for over the past 10 years that that's not really the case. That those markers for heart disease are there due to the chronic inflammation that is already present. You see, for heart disease, cholesterol is actually needed to patch up little spots in the blood vessels that need repair. It acts in a similar way like a scab would act on the skin. It's a temporary patch before the body can fully fix the issue. Now, of course, if the patch gets too large, it can start clogging up the artery. However, the real cause of why it gets put down there in the first place is because of the inflammation that's present. So cardiovascular disease is a disease of inflammation, of chronic inflammation. And this is going to be very important when it comes to Crohn's and ulcerative colitis, because that's what's happening, in a sense, in the colon tissue. So the primary benefit of niacin, again, is that it profoundly decreases chronic inflammation in the blood vessels. Now, what is the link here between the blood vessels and the gut? Well, niacin doesn't only reduce chronic inflammation in the blood vessels only. It also doesn't just reduce inflammation. It actually boosts the healing response. Like we've talked about in other videos, we don't just want to shut down inflammation. We want to increase the body's ability to resolve that inflammation. We want the body to be able to do the work it needs to do in order for that inflammation to not even need to be there anymore. Not just suppress it, but keep the cause still there. The way that niacin does this, the way that niacin kind of has this dual role of reducing inflammation while boosting the healing response, is essentially through one receptor. This receptor's name is called GPR109A. And I wouldn't, give you this receptor because it's kind of technical if it wasn't important. It's important because this receptor releases specific prostaglandins when activated. And one of these prostaglandins is prostaglandin D2, or PGD2 for short. Now, I'm not going to get into the technical details of exactly what prostaglandins are, but just know that prostaglandins are one type of mediator of inflammation. So when you have inflammation in a particular area, there's a bunch of different cytokines, a bunch of different prostaglandins, a bunch of different leukotrienes. There's all of these different cellular messengers that will direct the body on how to deal with that inflammation. So if there's certain type of messengers to get released, the body might deal with it in a more pro-inflammatory way. And if there's a different type of messenger that gets released, then the body might deal with that in a more anti-inflammatory way, or in the best case, in a way that will actually resolve that inflammation. And something like cortisol, the standard profound anti-inflammatory hormone, that just shuts them all down. No pro-inflammatory, no anti-inflammatory, just shuts it all down. And like we said before, how that can have benefit in the short term, it doesn't have benefit in the long term. So niacin changes how the body starts responding to inflammation, and it starts putting out these specific prostaglandins. The main one is PGD2, that acts as in a very anti-inflammatory way and in a very pro-resolving way that allows the body to more effectively deal with this inflammation that's there. So essentially, it upregulates the healing response to inflammation. Again, we don't want to completely shut down inflammation. We know that inflammation is a signal to the body that something needs repair and attention. And to give you some more examples, I keep using cortisol just because it's so broad spectrum. There's other medications that are not quite as broad spectrum as cortisol, but cortisol is just super broad spectrum, just shut down all inflammation. But there's other anti-inflammatory drugs that also have side effects linked to chronic inflammation. One of them was Vioxx. Vioxx was a very, very profoundly anti-inflammatory medication that originally came out for a form of arthritis. Usually it was used for rheumatoid arthritis, although it was used for other conditions as well. Similar to Crohn's and ulcerative colitis, rheumatoid arthritis is signified by chronic inflammation. It's autoimmune. It shares a lot of similar aspects. It's just in a different area. It's in the joints. Now, Vioxx, it was an anti-inflammatory drug that was used for RA and for other forms of arthritis sometimes. However, I think it was back in 2006, it got recalled because it ended up killing 140,000 people, mainly due to heart attacks. Now, how can a drug that's entire purpose is to be anti-inflammatory cause something like heart attacks? Well, if now you're starting to understand the link between inflammation and healing, you might start to realize that if you profoundly shut down the inflammation in the blood vessels, how are they going to repair themselves like they need to? Every organ system in the body needs continual repair. Some things, need repair more often, like the stomach lining needs to be almost fully repaired every 7 days. But every tissue in our body needs continuous repair and healing. And when we shut off the inflammatory response to that extent, it can inhibit the repair of the blood vessels and of the heart. And so in this case, with this particular medication, it led to a lot of heart attacks. You can see the same thing with Aleve. Aleve, obviously, it's used for back pain, for a lot of different inflammatory conditions. It's not nearly as powerful as Vioxx in terms of its anti-inflammatory effect, but it's there, it's still there. It still shuts off inflammation in a sense. And it's known, and again, I reference all of these studies in the PDF. So if you want to look up this particular study that I'm referencing, you can go to the PDFs to do that. But a leaf has been associated with a 14% increased risk of heart attack. So again, this idea of completely shutting off inflammation is not what we want to do. We want to allow the body to better respond to the inflammation. So what niacin does is it doesn't shut off inflammation really at all. What it does is it helps to regulate that inflammation. And it can actually boost the acute inflammatory signaling. You see, the exact same receptor that Vioxx, for example, that medication we were talking about in the last page, the exact same receptor or enzyme, it's an enzyme, sorry, that Vioxx shuts down, it's called COX-2, COX-2. Niacin actually increases that receptor. It doesn't shut it down at all. But that receptor is more of an acute inflammatory receptor. So it's something that responds to inflammation in a very short-term way. And niacin will boost that short-term inflammatory response, even though it reduces the chronic inflammatory response, which is exactly what you want. Now, it does this again through multiple mechanisms, but one of them is PGD2 again, or PDG2, and that's a powerful anti-inflammatory prostaglandin, and it helps your body more beneficially deal with that inflammation that's present. Now, the reason that this all ties in together so much with the colon tissue and with Crohn's and ulcerative colitis is because this receptor is the exact same receptor that butyrate activates. Now, what's butyrate? Butyrate is what's called a short chain fatty acid. When you eat something like fiber, or when we think about probiotics, or when we think about eating whole food, like whole fruits and vegetables, the reason that whole food is so good for your colon compared to processed food is mainly on how it influences your microbiome. So we have all of these different species of bacteria in our gut. And certain types of bacteria, the beneficial bacteria, will help to produce these short chain fatty acids. Essentially, they're very, very tiny fatty acids that are very anti-inflammatory for the gut. They are an energy supplier for the gut, and they help to reduce chronic inflammation of the gut. People with Crohn's and ulcerative colitis have been known to have very low butyrate levels. So this butyrate, what happens again is when you eat fiber or when you eat whole foods like whole fruits and vegetables, it'll go down, it'll bypass your initial digestion, it'll go all the way down to your colon. And when it reaches your colon, the bacteria will eat up that fiber and they'll poop out the short chain fatty acids, one of which is butyrate. And butyrate is the most anti-inflammatory one for the colon. When you get low in butyrate, your colon will start to suffer. For people that eat, very high fat diets, junk food diets, burgers and pizzas and all of those type of things, they tend to get very low levels of butyrate because they're not feeding their gut with the right foods. Their gut bacteria can't thrive. And so they're not pooping out these short chain fatty acids. They're not pooping out enough butyrate. Now, butyrate will go to the colon cells, and it not only gives them energy, but it actually reduces the chronic inflammation that can sometimes happen in the colon. And the way that it does this is through that GPR109A receptor, the same receptor that we now know that niacin activates. So we know that butyrate has a profound healing effect on the gut tissue. The problem is when you take butyrate orally by your mouth, not all of it reaches the gut and it gets metabolized just super quickly. So unless you want to have an enema containing butyrate, it's very difficult to deliver butyrate to the gut. And it doesn't have as strong of an effect because of how quickly it gets used for energy. And so that anti-inflammatory effect doesn't stay. Now that we know how niacin works and how it actually is reducing this inflammation, niacin can act as a supplemental form of butyrate in a sense. So for those with Crohn's and ulcerative colitis that are low on butyrate, you can take niacin and it's essentially acting as a butyrate mimic. It's mimicking this profoundly anti-inflammatory short-chain fatty acid that also allows the gut tissue to start to heal. So it kind of links this profound healing effect that we know niacin has on blood vessels, and it shows that that effect will be very strong in the gut tissue, because that's what butyrate is typically for. Butyrate can kind of go throughout the whole body. Butyrate has a global anti-inflammatory effect, but it's strongest in the gut because that's where it's produced. And niacin can mimic butyrate in the gut. So really, really powerful. Now, after researchers found this out, and they're like, hey, niacin might work just like butyrate and really help colon inflammation, they started doing a ton of mouse studies. One rodent study after another rodent study was confirming that niacin has a profound effect on the gut tissue, on colon inflammation, and with colitis or Crohn's type symptoms in rodents. So after enough of these rodent studies were produced, it actually led to a clinical trial, which unfortunately doesn't always happen with supplements. You see, with medications, they have a lot of funding. There's millions of dollars usually built in to fund medication studies, because if medications turn out to have a good effect, then they're going to make just a buttload of money on selling that drug to everyone all over the world with that condition. With supplements, you can't patent supplements. So a lot of the times, even though these cheaper rodent studies come out showing a lot of promise for a particular supplement, it doesn't always, a human study doesn't always come from that. Sometimes it just stops after the promising rodent trials and we never get a human study. But fortunately enough, they got one for niacin. So there was a human study, and it's called Niacin Ameliorates Ulcerative Colitis via Prostaglandin D2 Mediated Prostanoid 1 Activation. Now, don't worry too much about the title. We already talked about the prostaglandins a little bit. The title is essentially just saying everything that I've told you in the last slide. But I want you to look at this one part. Now, in this study, it was a combination of a rodent study and a human study. So it was a rodent study plus a clinical trial. Clinical trial is the second part of that paper. So if you happen to look up this paper, you're going to have to scroll down to get to the human part, because the rodent part comes up first. But when they tested niacin in humans, and they did it with an enema, so they did go up rectally with the enema to give the patients the niacin, they found that treatment with niacin containing retention enema effectively promoted ulcerative colitis clinical remission and mucosal healing in patients with moderately active disease. Now, this type of language is rare for a supplement with a clinical trial. To not just say that it helps, it reduced, but actually use the word remission. It shows that there was a very powerful effect. And when you look at the actual data, when you look at the raw numbers, you can see it did have a very powerful effect. Now, fortunately, we don't have to use an enema to have the effect from niacin, because niacin doesn't work just locally. It works throughout the whole body. It has a systemic effect. And if we use a time-released niacin supplement, then it actually does work its way down into the intestine before it gets completely absorbed into the rest of the body. So it works pretty well that way. An easy way that we can know that niacin has a systemic effect is because if you take immediate release niacin, you get the sunburn effect. It's called the niacin flush. If you've never seen it, you can look it up on Google Images or something. But if you take immediate release niacin, you get this flushing effect where it looks like you got a sunburn. And what that is it's actually this prostaglandin that's getting released throughout your entire body that's causing this effect. Just like I said before, it boosts inflammation in the short term, which is good because it increases the body's ability to heal in the short term, which means it doesn't last as long to get to chronic inflammation. It increases the healing response. Now and that's just good, again, it kind of shows how it's systemic. So we don't need it to be a super targeted enema in a sense. The time-release niacin will work just fine. Now, the time-release niacin, the benefit for that is that it doesn't induce that same flush that immediate-release niacin does. If you take a good time-release brand, it'll dissolve so slowly that you never get that flushing response. Every once in a while, someone might get a very, very mild response, maybe the first couple times they take it, but it's very rare. And as you continue to take the niacin, the flushing just becomes even less and less likely. We're going to get into that in a second. So how do you actually take niacin? So first off, niacin's been used, again, for heart disease for over 70 years. It's very safe. Sometimes you'll see some scare tactics on niacin, but as long as you know exactly how to supplement with it, it's a very, very safe supplement, vitamin. So the one that you want to get, and this is my favorite brand by far for niacin, is time-release niacin by Doctor's Best. There are other forms of time-release niacin, but sometimes they don't work as well as Doctor's Best does. And when they don't work as well, instead of having just a little bit of niacin that dissolves slowly over time, you can get like a big chunk that dissolves, and then you might get a little bit more of a flush. And it's not bad, it's not dangerous at all. It's just uncomfortable, and you might not want to turn red in public. So Doctor's Best is a great supplement. It dissolves super slowly. Very few people have any problems with the flush. I've never had anyone that wasn't able to take it because of the flush. So very, very good way to take niacin. Now, niacinamide and inositol hexanicotinate are two other forms of niacin that you'll see available that do not work. They do not niacinamide does not activate the same receptor as niacin, so it doesn't work at all. And inositol hexanicotinate, it can have maybe a tiny bit of an effect, but it just doesn't work nearly as well as the regular time-release niacin. However, if you look up the supplement, if it might say on the front of it, time-release niacin. When you look at the back part, then it'll say inositol hexanicotinate as the ingredient on the supplement facts. That's not the one you want. It should just say niacin or time-release niacin on the back. Again, if you get the time-release niacin by Doctor's Best, you'll get the right one because they don't have the other one. So that's really what I recommend. The dose for niacin can be anywhere from usually 500 milligrams, which is 1 pill, to 1500 milligrams, which is 3 pills. There's different ways that you can take this. So I'd recommend just starting with 1 pill, seeing how you respond. If everything's going well, if it seems to be helping, I would move up to 2 or 3 pills and just experiment a little bit. You're going to have to see what works for you. I've had patients that 1 pill was enough and that's all they needed. I've had patients that had to go on 3 pills. So you're going to have to see what works for you. Now, in terms of the effect that it has on your body, you can take all 3 at once with a meal and it'll work just fine, just as well as splitting up into 3 separate meals. The problem with taking 3 at once is that you get a higher risk of the flushing effect compared to splitting them up. So most of the time, patients will like to split them up into, if they're taking 2, they'll just take lunch and dinner or breakfast and dinner or whenever. If they're doing 3, they'll take them with their 3 main meals. But again, the timing doesn't really matter. You should take it with a meal. That's the only effect the timing should have. But if you split them up, you'll have less chance of a flush. Again, I would start with 1 pill, and then after a few days or maybe a week, you can go to 2 pills or 3 pills and kind of just experiment. And again, work with your doctor. I'm going to keep saying throughout the course, just for legal reasons, that whenever I bring up dosing, whenever I bring up a suggested supplement, this is not medical advice for you because I don't know you personally. I'm not your treating physician. So I can't make that type of advice. So this is for informational purposes only. Now, what you do with that information is up to you. I suggest that you work with your doctor, again, for legal reasons. And your doctor might have you under some type of medication. It's just always good to work with your medical provider when adding supplements, changing supplements, or adding and changing stuff with your diet. But again, this is what's worked in the research and what I've seen personally with other patients of mine. Now, the main side effect of niacin, if you ask medical doctors, they're going to tell you that it can raise liver enzymes. Some of them might say that it can actually damage your liver. Now, I don't want you to get afraid of niacin because of this. because there's a very, very simple solution. This is due, there's a reason that liver enzymes raise. It's due to what's called methyl group depletion. Now, again, I'm bringing up this terminology, but I'm going to explain it very easily. When you take niacin, your body eventually has to metabolize it. It has to break it down so that you can excrete it, just like when you take anything. So with niacin, the way that your body does that is it attaches a methyl group onto it. It's just one carbon with 3 hydrogens. It doesn't really matter what exactly it is, but it's what the body uses to attach onto niacin so that you can excrete it. Now, the reason this is a problem is because you're using up those methyl groups. You don't have an infinite amount of those in your body. You have a storage system, you have a supply. So you're using up these methyl groups to excrete the niacin. And so you can become deficient in these methyl groups. Once you start becoming deficient in the methyl groups, then your body's liver enzymes will start raising because your liver has to start working harder to metabolize the niacin. So what you need to do is you just need to replace the methyl groups that the niacin is using up. The way that you do this is through a separate supplement called trimethylglycine. This again is a natural supplement, just like niacin. Trimethylglycine is found in things like beets and spinach or other leafy greens, for example. So it's found in a lot of different foods in our diet. But when we take niacin, we're going to need more. And so the easiest way to ensure that you don't get these liver side effects is to just take the trimethylglycine when you're taking niacin. Now, if you're going to only take niacin for 1, 2, 3 months, it's not going to be a problem. But if you decide that you want to stay on niacin long term, just because of how much it's helping you, for example, then you're definitely going to want to take trimethylglycine with it. Trimethylglycine is an incredibly safe supplement. It's in our food naturally. It has side benefits. Sometimes it helps to reduce insulin resistance, for example. It also is very liver protective on its own, but it's very, very safe. No long-term bad side effects. So that combo is really my suggestion of what I tell people to take is if you're going to take niacin long-term, you just want to take trimethylglycine with it. Now, if you go on Amazon or you go on a supplement store, you might see it sometimes trimethylglycine. Sometimes you'll see it as TMG, which just stands for trimethylglycine, but TMG. Or you might see it called betaine. All 3 of those are the same thing. They're just synonyms for each other. So just get that and you'll be fine. Usually they come in 500 milligram pills, just like niacin. Sometimes they come in 1 gram pill or 1,000 milligram pills. Either way is fine. The amount of TMG or trimethylglycine that you want to take, it should be equivalent at least to the amount of niacin that you're taking. So if you end up taking, let's say 2 pills of niacin a day, which is 1,000 milligrams of niacin, then you just want to take 1,000 milligrams of TMG every day as well. You don't have to take it at the same time as niacin. You can, it doesn't matter. You can take the TMG at any point. It doesn't need to be taken with food. So just make sure at some point throughout the day you get the same amount of TMG in that you're getting from the total amount of niacin that day. As long as you do that, your liver will be fine. Now, still, to be on the super precautious side of things, I usually recommend just to get a lab drawn like 6 months after you start supplementing, just to see what your liver enzymes are, if they've elevated or not. The vast majority of the time, you'll see no elevation in liver enzymes. Sometimes they can actually even fall because niacin on its own is actually liver protective. It's only when the methyl groups start to become depleted that niacin can start straining the liver, it needs to just work a little harder. But if you have enough methyl groups coming in, niacin on its own is actually protective. Like there's a lot of studies showing that niacin protects your liver from the effects of alcohol, for example. So it's protective on its own, but we just need to ensure that we don't deplete those methyl groups in the process. So niacin is truly one of the big hitters when it comes to supplements for colon health. I encourage you to give it a shot. Again, all my previous disclaimers still stand. Make sure you work with your medical provider, all of that stuff. But I hope you give it a shot because it could be something that can really help you. So I'm really excited for you to try this one. Now, this isn't the only big hitter that we have. If you saw the first slide of this PowerPoint presentation, I called it the big four. So there's actually 4 supplements that are big hitters, but we are starting with a very powerful one first. So I hope you give it a shot. The next presentation that we're going to be talking about another supplement that also is very, very important for colon health, for Crohn's and ulcerative colitis. So stay tuned for that one. In the meantime, you can go ahead and start this one though. They don't need to be combined or nothing like that. Each one is kind of standalone, but they do work well together as well. So this is the end for our first supplement here, our first strategy. I hope you enjoyed it. I hope you're excited, and I will talk to you next time. Take care.